Vanakkam, good morning. In this video, we are going to discuss about the pathophysiology of drowning. Drowning is respiratory impairments due to the submersion or immersion in a liquid, especially water in water. Submersion means part of the body, especially head is uh, immersed in the water. Head only sink in the water. Immersion means whole body sink in the water. Stages of drowning. First stage is the initial struggle stage. It involves gasping, air hunger, and panic. Increases the breathing rate. Victims may attempt to stay above the water level, which increases the demand for the oxygen. Stage 2, submersion. The victim becomes submerged under the water surface. Stage 3, hypoxia and loss of consciousness. Lack of oxygen lead to hypoxia and unconsciousness. Stage 4, cardiac arrest. Not receive timely resuscitation, cardiac arrest may follow. Pathophysiology of drowning. Airway reflexes. Laryngospasm, a reflex response that causes the vocal cord to close when the water is inhaled, temporarily protecting the lung. The laryngospasm prevent the entry of the water into the lung. So this is a temporary protection. The laryngospasm is failed. The water is inhaled, leading to fluid in the lung. It washes out the surfactants. Hypoxemia. Oxygen level decreases due to the impaired gas exchange and resulting in hypoxia. So water is accumulated in the alveoli, so it will affect the gas exchange. It is also wash out the surfactants. Pulmonary edema, lung filled with the water. It interferes with the oxygen exchange, leading to further hypoxia. Depend on the type of the fluids, the pathophysiology is different. In the saltwater drowning, osmotic flow of water from the bloodstream to the lung. So the lung contains the seawater. So it concentration is more. It receives the water from the plasma from the blood. So it produces a pulmonary edema. So saltwater drowning produces a pulmonary edema. The freshwater drowning, water enter to the bloodstream from the alveoli to the blood vessels. It produces a hemodilution. Other systemic effects of hypoxia are cardiovascular changes, tachycardia. So initially compensate the decreased oxygen levels. Finally, bradycardia is occur due to hypoxia, leading to arrhythmia and cardiac arrests. Acidosis. Body enters metabolic acidosis due to inability to maintain the normal respiratory functions, leading to decreases the blood pH. Cerebral hypoxia. Brain tissue is highly sensitive to oxygen deprivation, leading to confusion, unconsciousness, and potential brain damage. Complication after drowning. Acute respiratory distress syndrome, ARDS. Fluid in the lung and inflammation lead to ARDS, causing severe difficulty breathing. Aspiration pneumonia. The inhalation of the water can introduce bacteria into the lungs, causing infection that produces aspiration pneumonia. Hypothermia. Prolonged exposure to cold water can lead to hypothermia, further compromising the victim's ability to survive. Recovery and post-drowning care. rescue breathing and cardiopulmonary resuscitation. Early intervention with the cardiopulmonary resuscitation can prevent brain damage and increases the survival chances. Hospital care. Mechanical ventilation may be required to support breathing. Monitoring for complications like acute respiratory distress syndrome and pneumonia is critical. Long-term effect. Survivors may experience neurological deficit depending on the duration of the hypoxia and quality of resuscitation. Prevention of drowning. Education. Importance of water safety education to prevent drowning, especially in children. Life-saving measures, use of life jackets, life cords, proper swimming supervision. CPR training, teaching people basic CPR techniques, cardiopulmonary resuscitation techniques to save lives in emergencies. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.